Hi, Kim Roble here with a review of the OnQ peripheral nerve pain management system. So I recently had a rotator cuff repair. It's pretty significant. I had two completely torn tendons and one partially torn, and biceps tendinosis, something like that. Anyway, so I've never been through this before, where when I woke up they had me fully slinged up and everything, but I have one more piece of equipment here, and that is the OnQ pain pump. So essentially, this is pretty cool. Inside the little bag that they hang around your neck, a little side bag, you've got this. And that is the medication, the numbing medication that's slowly sprayed onto or expressed onto your peripheral nerves to continue blocking the pain for that shoulder repair. I've only got one hand, so you'll just have to bear with me. That little one right there, the little clip, the first one you see, is basically to clip it shut. You can clamp it shut so it stops the flow. I currently have it clamped shut because I'm just about ready to have it removed and go without it. I'm 4 days post-op. I don't know what this cute little thing is, but a little thing. And then it has the control. And there are different ones. My doctor actually had it set at a number 6. It went from 2 to 14. They automatically set it at 6, but in consultation with my anesthesiologist, we lowered that down to a 4 on day 2 because 6 was just too much for me. Anyway, goes through the little hose. Tuck it back in real quick. Almost. I'm trying not to kink the hose either. Oh, I dropped it. Shh. Oh, hung in there like a champ. All right, let's try one more time here. I might cut that part out. All right. Anyway, so it basically is strapped up and it comes up to here, and then they've got it just secured onto me. There does seem to be a port right here, so I don't know if there's actually a needle going into me at this point, or if it's just the hose taped down and there's some kind of a something that attaches it to the rest. So then it goes across my back and over into here somewhere. So basically, how you get rid of that? So basically, you actually take it home or take it out at home. And normally that ball I showed you, it starts out full and like just a big round ball, and it's shrunk. It's about half the size it was when I left the hospital. And normally with a higher dosage, it would already be like flat, the plastic with like kind of an apple core in the middle, and that would be done, and it wouldn't be administering any more medication. Mine still has a lot left, but I just don't really need it. So again, that's why I've clamped it off for now to see how it goes. Regardless, I would take it out tomorrow because there is a risk of infection if you leave that catheter in too long. So anyway, you take it at home. What's going to happen is my husband's going to be the lucky guy who is going to carefully, like, will clamp it shut, and then he's going to carefully start removing all the tape that belongs to that. And then when you get it, you wash your hands really good, but you're going to slowly just pull it out, gently. And the whole thing should come out, and there's a little black tip on it so they know that you got the whole thing and there's nothing left in there. If it should start to stretch or tug or anything, you're advised to just stop and call your doctor and let them deal with it when you can get in. So anyway, we're planning on doing that either later tonight or tomorrow, but I'm gonna say right now, my recovery so far, it's Saturday, my surgery was Tuesday. Rotator cuff repair, I understand, is one of the most painful surgeries. I've had my ACL done, I've had a breast aug, I've had a tummy tuck. This has been nothing, and so I know that pain is being controlled by this thing, or was. And typically I do the first 3 or 4 days with like oxycodone or something, and then I wean myself off because I don't care for the opiates. And then I just moved to ibuprofen and Tylenol. So I'm on day 4, so what I'm hoping to do is go straight from this to the ibuprofen and Tylenol or acetaminophen. So that is my review of the On-Q, not to be mixed up with QAnon. On-Q, this has use and purpose. Pain relief system. What a huge step forward in pain management for post-surgical, whatever you have done. Thank you for listening. If you like this kind of thing, please like and subscribe. My name is Kim Roble. Thank you for watching.